think our next segment was written just for me. Are you tired of that lingering pain that won't go away? Well, there is good news. Non-Surgical Orthopaedics is one of the first practices right here in Atlanta to offer regenerative medicine. Here to explain what in the world that means is MD and CEO Dr. Arnold Weil. Welcome back, doctor.
Thank you. It's great to be here.
It's so great to have you. And I was reading all about this segment last night, and I thought, oh, take my pain away. Since he's been on the show, he knows I've had some back pain from working out, I think, a little too hard months ago. Still lingering. So before you get to some great treatments that are sort of state of the art now and taking that pain away, just remind everyone who you are and your background a little bit.
Sure. I mean, our practice, non-surgical orthopedics, actually treats the kind of injury that you have. We've really specialized in back pain for so long and various orthopedic injuries. And we're in Marietta and Carrollton and Canton. But, you know, we're going to talk about regenerative medicine because that's something a little more fresher and more recent. We've really been doing a lot of that, and one of the first practices to offer that in the area.
Good. I think a lot of people get scared, as I have, to even go see a doctor when you have back pain because at the end of the day, you're thinking, oh no, surgery. And that these days is sort of the last resort, right?
Absolutely, absolutely.
And one of the things that we're talking about today, or the main thing, is this regenerative medicine. What does it do?
Well, regenerative medicine is a type of non-surgical treatment. The goal is to try to heal the body, allow the body to repair the injured area. So there are a lot of different types of regenerative medicine, and the goal really is to use the body's own stem cells and own mechanics to try to repair those tissues and get somebody back to their activities.
Okay, so specifically, what kind of different treatment options do you offer in terms of stem cells and all the different ways that you can help us?
Right. So prolotherapy is probably one of the areas that's been around the longest. And really, that's a type of procedure to really increase inflammation, cause inflammation, allow the tissues to heal.
Sure.
But beyond that, we use a lot of stem cell type treatments, such as PRP, or platelet-rich plasma injections, and also other types of stem cell precursors, such as amniotic stem cell therapy, and also bone marrow aspirate concentration. And we can use those body stem cells, again, to kind of promote that healing and allow those tissues to repair themselves.
Now, how is it helpful for somebody like myself or someone who has a sports injury? In what ways are we going to see results?
Well, you mentioned muscle spasm, and you've had some problems with your own back. But muscle spasm is a symptom, and there's something that's really promoting or causing that muscle spasm. So often after proper diagnostic tests, if we can determine that it's a ligament or a tendon, we may decide to try some of these different types of injections to promote that healing. For example, back pain.
Yeah.
There's intradiscal stem cell treatment. We actually inject these stem cells and these precursors into the disc to help promote that disc healing.
Right. It's incredible now. Stem cells, that seems to be the buzz in terms of helping out so many different areas and aspects of our health. So this is just yet another way. But why would somebody go this way rather than the traditional route? What's the real reason?
I mean, traditional medicine, again, focusing on non-surgical, tends to be medications, therapy. And sometimes if we're talking about injections, usually they're steroid injections. And they can work very well, but utilizing the stem cell therapy, we're actually putting in stem cells or the proteins that promote the stem cell activity back into the area to try to really reduce the inflammation and promote the healing.
And at the end of the day, nobody wants to be on a bunch of medicine, severe painkillers.
And avoid surgery.
And avoid surgery, absolutely. Right. And now I think you're going to bring Mr. Skeleton in. Do that for me. All right, let's talk about I was like, is this just a prop, or are we actually going to use it?
In the spirit of Halloween coming up,
In the spirit
right?
of, yes, of October. All right, what conditions do you treat? Show me here on.
Well, just to give an example, and patients who have knee pain, we would actually inject the areas around the knee. Again, different anatomic points.
Sure.
With that stem cell treatment, again, to promote that regeneration of tissue and promote healing. So we can do the knee, we can do the hip.
Right.
Some of these can be done in the office. Some of them are done under fluoroscopy in a surgical center, but the shoulder, and again, even into the areas of the back and the spine.
I think that's where I need
we can use a lot of different anatomical areas to inject, and again, try to get somebody back to their sports activity, back to their normal activities as quick as possible without surgery.
Sure. I think at the end of the day, we just want to have a normal life. Like when my daughters say, let's go for a walk, and they're like, oh, I can't. It makes you feel bad. You just want to be, and have that optimal health to make sure you can do the things that you love. And let's talk about the number of injections. I'm sure it varies, right?
Well, again, if we're injecting like the area of the knee, we might do anywhere from 3 to 6 injections in this area around the knee. And again, these may be repeated every month, 2 or 3 months in a row, again, to get the best effect.
Okay, and a good candidate, who would that be?
Well, really anyone who's had an injury that hasn't responded with conservative treatment or really wants to try to get back to their activities sooner may be a great candidate. We really have to evaluate you first, but most patients tend to respond very well from these treatments. Any type of sports injury, any type of, a lot of times, back or neck injuries are really great candidates for this.
Fantastic. Such great news. And I have to ask, before we go, side effects? What would the side effects be typically?
You know, again, we're using your own blood to take some of these stem cells and inject them back. So most of the time, the side effects may just be soreness from the injection, maybe a little bit of swelling, things we're trying to do when we want to promote inflammation.
Sure.
But really, there's very few risks and very few side effects that occur from this, aside from a little discomfort, maybe some swelling and soreness for a few days.
Right, just for a few days.
Right.
But then you're feeling
much better.
Much better, like your old self.
Exactly.
Awesome. Well, thank you so much, Doctor. And once again, make sure everyone knows where you're located so they can call now to book an appointment.
We're located, our main office is in Marietta, Georgia. We have other locations in Canton and Carrollton, and you can reach us at 770-421-1420, or our website is lowbackpain.com.
Fantastic, Doctor. Always so good to see you. We appreciate your time.
Thank you very much.
All righty. And if you would like more information about non-surgical orthopedics, please give them a call right now. No excuse to suffer. 770-421-1420, or log on to lowbackpain.com. And this segment was paid for by Non-Surgical Orthopaedics.